For the vast majority of Americans, this is our first pandemic. Few of us, of course, were around in 1918 when the Spanish flu claimed an estimated 50 million lives worldwide. Now, of course, things were completely different then. Or were they? ONR's Jason Doyle reports on a past somewhat similar to the present.
Dr. Earl Mabry of Enid recently celebrated his 100th birthday.
I'm famous because I'm 100 years old. That's a tough way to get there.
He's seen a lot of history, but the reason why he's in Oklahoma, his father, Dr. Earl Mabry, had just left the Army as a medic during World War I. His journey took him to southwest Oklahoma.
And he wanted to see his brother in Mangum, Oklahoma. So he boarded a train and went to Oklahoma, and he was met there by the Greer County Sheriff and a local doctor, and they recruited him off the train.
It worked. They handed Dr. Mabry a pill bag, gave him a Ford Model T and directions to a farmhouse just outside of Mangum.
And when he got there were 12 in the family, and there were 7 of them dead. And it was like that for months and months, just people dying all over the place.
Today, Oklahoma doesn't have to recruit medical professionals this way to fight the current COVID-19 pandemic, but there's still a bit of history repeating.
There was never a statewide control of the reaction to it. Largely, it was a localized thing. Only 2 towns required masks at the time.
Dr. Bob Blackburn of the Oklahoma Historical Society says even the complaints about today's efforts to limit the spread of COVID-19 sound a lot like those during the 1918 Spanish flu outbreak.
People would complain about being denied the ability to go shopping. Merchants didn't like the fact that students were required to stay on campus. So there was this debate about, well, what's good for you may not be good for me. It's hurting me. Why go through it?
You had schools closed down. You had theaters, churches, public gatherings.
Historian and author John J. Dwyer says another similarity between now and then, what to name the pandemic.
There's been a lot of debate about what the current pandemic is going to be called. You know, is it COVID, coronavirus, Chinese flu, whatever? There's been a lot of names or a lot of different opinions on that. And I think such was the case back in 1918. There were a lot of names for it, but what emerged was 2 slight variations: Spanish flu, Spanish influenza.
Just like we see some not-so-scientific approaches to COVID-19 today, there were all kinds of cures that promised to keep the deadly Spanish flu at bay.
There was a trend of recommending folk medicines. Patent medicines flew off the shelves. People thought that they could take these wild root, juices and pleasant pellets, whatever they might be called.
While the numbers for the 1918 flu pandemic are not exact, the Spanish flu affected more than 100,000 people in Oklahoma. The estimates for the death toll range between 7,000 and 7,500 Oklahomans. In comparison, so far, COVID-19 has infected at least 66,700 Oklahomans. As of September 10th, 876 Oklahomans have died.
You're talking a magnitude before this was over in a year and a half. As many as 100 million people worldwide died, as much as 5% of the global population.
The diseases do diverge as far as who was primarily impacted.
But at that time, in 1918, it was largely people from 20 to age 40. And so it affected a different part of the population.
Another difference, as illustrated by Dr. Mabry being recruited just coming off a train, there was a lack of public health infrastructure in 1918.
Oh yeah, the changes in medicine, your antibiotics, your vaccines, everything they didn't have to treat the Spanish flu.
We were even less well prepared in the medical community in 1918 because 1/3 of all Oklahoma doctors and 50% of all nurses from Oklahoma were in the armed services. So we were depleted in our healthcare facilities.
The Red Cross stepped in to help Oklahoma.
They responded in 1918 and tried to fill the gap. Volunteers got involved, health departments, but medical public health was poorly funded at the time, and the state was not prepared for it.
After 100 years, Dr. Mabry believes modern medicine will overcome COVID-19.
in the Spanish flu days, they couldn't handle it, but now they can handle the Spanish flu, and hopefully real soon they'll be able to handle the virus that we're having today.
Jason Doyle, the Oklahoma News Report.
Thank you very much, Jason. While the origin of the Spanish flu is unknown, many experts believe it actually started in Haskell County, Kansas, just a few miles from the Oklahoma state line.